Living so close to London, I suppose we have worries about pollution and things that can happen there, especially, terrorist threats, and they say about the chemicals that can be released.
Because I wouldn't know anything about rashes or anything, so I would, obviously, if the doctors isn't open, then I go straight to hospital, but I certainly, or the NHS Direct. This is another point of call, which I have called many times before.
Biosurveillance is fast becoming a media buzzword. Put simply, it means gathering enough information to help control outbreaks of natural infections, industrial accidents, or even bioterrorism. Extensive coverage of recent scares, such as the polonium contamination, avian bird flu and SARS, have meant that the general public are more aware than ever of biological hazards. No one knows what or when the next major outbreak will be, but one thing we know for sure is that we need to be prepared.
Towards the end of last year, I was at a restaurant in London, and after that, not feeling too well, didn't really know what was going on, not the sort of person to contact the GP, and then I heard about the polonium scare with the guy who had the radiation poisoning, and it was playing on my mind a bit, and nothing was getting better and seemed to get worse, so I contacted my GP.
The only thing that we've ever had concern about was what happened at Hemel Hempstead last year with the oil refinery that exploded. And when you're coughing, whether you think it's the pollution in the atmosphere from that.
When the public are worried, they understandably want to seek reassurance from their GP or local A&E department, but this can lead to these essential services struggling under the demand.
Currently, when there's an incident or an outbreak, we can watch it on BBC News, or traditionally we get a fax from the government office, the CMO, whoever's appropriate, just informing us what to do if an outbreak of such and such occurs. The same as we would do for a batch of medication, faulty batch of medication, or a forged batch of medication. It's a very slow process. If an incident did happen in the community, we get a huge influx of extremely worried people, and it might be that they're correct to be worried because something dreadful had happened, or it may be that it's a complete false alarm, but to have the information at our fingertips to be able to relate to them and either put the mind at rest or deal with it in the appropriate and correct manner would be invaluable.
Stemming public panic at the time of an outbreak relies upon the free flow of reliable information as soon as it becomes available. But at the height of a new epidemic, this can be difficult to come by in time to make a real difference.
I'd like to see a solution implemented that meant I could have the word, what was going on at my fingertips, being updated as the day went by, so we'd know hour after hour, minute after minute, what the correct advice was and how the situation was unfolding. That would be invaluable.
Health authorities and policymakers are committed to providing more options to healthcare workers when it comes to identifying symptoms in their patients. They need a more efficient way of getting the right advice out there as soon as the next crisis hits. One company that's been trialling a new software system think they've developed a solution.
There's a big scare at the moment that avian flu will hit the UK, and how do we manage that situation? How do we identify when there's an outbreak and where it is, and how do we try and contain that? The biosurveillance product is probably a component in an overall service that would be managed by government or government departments. It's aimed predominantly to actually create a kind of a structured system in chaos. It allows them to capture information that helps them make decisions quickly, but also allows them to feed back information to patients or to the public. The way the system is designed to work is that we actually provide a web-based tool so it can be accessed from anywhere in the UK or the world even. It's basically a solution that prompts the person on the telephone or face-to-face with the presenting patient with a series of questions to determine whether they are at risk, and if they are, what course of action they should take next, whether they should take tests or should refer them onto a hospital or A&E, or just refer them to the chemist for flu because they're not affected. It can happen in real time, and it's important that it happens in real time in some instances, because what we want to be able to try and do is identify outbreaks quickly so that we can contain them.
In a situation where there had been an incident or a potential incident or a real or imaginary incident, it would make my job a whole lot easier if I could have immediate access to information and find out there and then with no delay for someone to write a fax and fax it to us. Without any delay, it would be nice just to have that information at my fingertips.
in this sort of situation, you're going to get lots and lots of calls. It could be thousands of calls per hour with people phoning in because they're uncertain about what's going on or whether they're affected. And it helps clinicians and nurses, whoever is managing the calls, to actually deliver consistent information. Our goal is to take the stress out of a situation as it arises, and that's basically done by helping the people that are running the centres, the clinicians, the county councils or whoever, to actually provide meaningful information to the people at the right time, but and also in the same context, collect information that allows them to monitor and control their response to any situation.
It seems that both the public and healthcare workers are still searching for a way of making sense of the biological and chemical threats that can at times seem to surround us. We need more information and new ways of managing outbreaks. And with a new health scare always just around the corner, it seems like there could be a genuine need for the Clinical Solutions biosurveillance system.
To actually have something at our fingertips on the internet, because of course we can go straight on the internet at the back of the consultation, back of the screen, that would be invaluable, just to be able to say, what's your worry? Well, let's allay your fears or deal with it in the appropriate manner.
Our view is that we want to be there to make a difference.
Clinical Solutions, bringing decisions to life.